Close the door. Close the door. Maybe is concerned with the which part of the heart? Yes or no? Yes or no? So we have seen what is atrial diastole. We have seen what is atrial systole, and also we have seen what is atrial diastole. Yes or no? Then we have seen what is ventricular systole. We have seen what is actually ventricular. So see here, when we're talking about ventilation, we're talking about ventricular decolonization. 0.53 seconds. How many seconds? 0.53 seconds. How many seconds, ma? 0.53 seconds. Seconds? 3 seconds. Ventricular diastole will last about 0.5 seconds. Will last about 0.5. How many seconds? 0. Atrial diastole. So third phase means rapid filling phase. What is the third phase? Rapid filling phase. What is fourth phase? Slow filling phase. What is the fourth phase? Slow filling phase. Fifth one is last rapid filling phase. What is it, ma? Last rapid filling phase. You get my point? Now listen to me carefully. What happens when a ventricle contract? The blood in the ventricles is? Listen carefully. When atrium is contracting, what is happening? Blood from the atrium is entering into? Yes or no? Yes or no? Now when ventricle contract, what will happen? The blood from? You are not getting me. I told you clearly. Semilunar valves will open. That means where the blood is going? It is now blood is filling or blood is going out? Blood is going out. If it contracts, blood is going out. If it relaxes, blood is filling. Yes or no? Yes or no? So ventricular diastolic phase, that means here what is happening? Blood is filling or going out? Wait, we are talking about ventricular diastole, not ventricular systole. Systole అంటే ఏం చెప్పాను? What did I say? If I am talking about systole means? Diastole means? Diastole means? So when heart muscle is contracting, blood will fill or blood will get empty? What the malli? When heart contracts, blood is filling or blood is emptying? Blood is getting empty. So when atria are contracting, ventricles are relaxing. Yes or no? So when atrial diastole, atrial systole, ventricular diastole, ventricular systole, atrial diastole. Yes or no? Yes or no? Then what is the confusion? First answer is namanku misleading ఉండకూడదు, అక్యురేట్ ఉంటేనే ఇవ్వాలి, అవునా కదా? సో ఫస్ట్ ఒక ఆన్సర్ చెప్పు అనుకో, మిగతా క్లాస్ అంతా ఏం ఫాలో అవుద్ది? సో మాట చెప్పే ముందు మనం ఏం చేయాలి, కొంచెం ఆలోచించి చెప్పుకోవాలి. ఓకేనా? సో ఇఫ్ నాట్ ఎంటైర్ క్లాస్ విల్ విత్ లైక్ మిస్లీడెడ్ ఆర్ మిస్గైడెడ్. యు గెట్ మై పాయింట్? అర్థమవుతుందా తల్లి? ఎస్ ఆర్ నో? లిసన్ కేర్ఫుల్లీ. నౌ వాట్ హ్యాపెనింగ్ when we are talking about ventricular diastolic phase? We are talking about ventricular diastolic phase. That means the ventricle. Next picture will look, sir. ఇంకా పైకి సార్, పైకి తీసుకెళ్ళి కిందగా కంప్లీట్ ఇక్కడ లిసన్ కేర్ఫుల్లీ. Now look at this picture. When these two are in contraction phase, these two are in relaxation phase. So contraction phase I am calling it as systole, relaxation phase I am calling it as diastole. So I am talking about now ventricular diastolic phase. I am talking about ventricular diastolic phase. So the ventricles are in relaxing mood or contracting mood? Relaxing mood. Ventricles are in relaxing mood. So if the ventricles are relaxing in mood, what type of valves will close? Semilunar valves are closing. Semilunar valves are closed. What are they preventing? They are preventing the re-entry of blood from aorta and pulmonary. Yes or no? Yes, sir. Yes or no? Now till now we are clear. Actually what opened this side, tricuspid valve has opened. This side, bicuspid valve has opened. Now the atrium are filling the blood into two ventricles respectively. Right side is concerned with filling the right ventricle, left side is concerned with the left ventricle. Now how this filling occurring means, it is occurring in 5 stages. It is occurring in 5 stages. Now actually total time is about 0.5 seconds. Total time is about 0.5 seconds. But within this 0.5 seconds, 5 phases are going on. How many phases are going? 5 phases. Now, first one is protodiastole. First one is what, ma? Protodiastole. Now listen to me. This protodiastole is the first stage of ventricular diastole. It is the first stage of ventricular diastole. So that's what they are calling it as protodiastolic phase. That's what they are calling it as protodiastolic phase. Now, due to the ejection of blood, the pressure in the aorta and pulmonary artery increases and the pressure in the ventricles drops. What's happening here? When the blood is emptied in the systolic phase, what happens? When the blood is emptied completely, semilunar valves are opening. In systolic phase, ventricular systolic phase, what is opening? Semilunar valves are opening. What is closing? Tricuspid valve is closing, bicuspid valve is closing. So what happens suddenly? Now aorta are filled with blood. Aorta and pulmonary arteries are filled with blood. Now if they are filled with blood, pressure is increasing in aorta and pulmonary arteries. Yes or no? Yes or no? Now ventricles are empty. Ventricles are empty. So the pressure in the ventricle is low or high? Low. The pressure in the ventricle is low. Yes or no? Then who is getting filled with blood above? Both the atriums are filled with. So the pressure is more now in ventricular or atrium? Atrium. Yes or no? Yes or no? Yes, so always from high pressure to low pressure. So what happens here downside as there is no pressure, the pressure which is built up in the atrium will open the valves. Will open the valves. So that the blood is entered into the ventricles. So that the blood is entered into the ventricles. And this starting phase is called as protodiastole. It is called as protodiastole. Now, when intraventricular pressure becomes less than the pressure in the aorta and pulmonary artery, when intraventricular pressure becomes less than the pressure in aorta and pulmonary artery, what happens? Now, if the semilunar valves are open, what will happen? The blood from aorta and means aorta and pulmonary arteries will again enter into the ventricle. You want that to happen? You don't want that to happen. That's why the semilunar valves are closing. The semilunar valves are closing. Next one. No other change in the heart occurs during this phase. There is no other change which is occurring during this phase. Now, ventricular diastole began. Ventricular diastole began. But in this ventricular diastole, there is a phase which is called as protodiastole. There is a phase which is called as protodiastole. And in this protodiastole, actually what happens is the ventricle's pressure is becoming low. The ventricle pressure is becoming low. The ventricle pressure is becoming low. And the pressure in the aorta and arteries, pulmonary arteries and arch of aorta are increasing. So when this pressure increases, automatically the semilunar valves are closed. Automatically the semilunar valves are closed. And the tricuspid and bicuspid valves, they are also begin to open. They also begins to open. And the pressure in the aorta means arteries also increases. The pressure in the both the left and right atriums also increases. Do you get my point? So this phase is called as protodiastole. This phase is called as protodiastole. So how many phases are there in ventricular diastole? So what is the first phase? Protodiastole. What happens in the protodiastole period? The pressure in the ventricles decreases. The pressure in the ventricles decreases. And the pressure in the both aorta and arteries increases. So with the increase, what is happening? Pulmonary semilunar valves are closed. Pulmonary semilunar valves are closed. Am I clear? Am I clear? What is the second phase? We'll see. Isometric relaxation period. What is the second phase? Isometric relaxation period. Now it lasts about 0.08 milliseconds. It lasts about 0.08 milliseconds. Now listen to me. Isometric relaxation is a type of muscular relaxation. It is a type of muscular relaxation. Now it is characterized by decrease in the tension of muscle fibers. Decrease in the tension of muscle fibers without any change in length of the fibers. Without any change in the length of fibers. So when we are discussing about ventricular systole, I told you there is isometric contraction phase. I told you there is one isometric contraction phase. Exactly what is happening in this isometric contraction phase? What is happening in this isometric? See here, the tension in the muscle fiber is increased without any change in the length. Without any change in the length. That is isometric contraction phase. So there is muscle fibers are there, but the length of the muscle fiber is not changing. That is isometric contraction. Then opposite to that, isometric relaxation which is occurring in diastole, here the tension is decreased, but there is no change in the length of muscle fiber. There is no change in the length of muscle fibers. Am I clear? Yes, sir. Am I clear? Yes, sir. Yes or no? Yes, sir. Listen to me carefully. Now, what is happening here? Isometric relaxation, ventricular muscle is also called as isovolumetric relaxation. Isovolumetric relaxation. When I am discussing about ventricular systole, I told you when I am discussing about isometric contraction phase, it is also known as isovolumetric contraction phase. It is also known as isovolumetric contraction phase. Yes or no? Yes or no? Yes, sir. We'll discuss one by one. Now listen. What is this rapid filling phase? What is this, man? Rapid filling phase. What is the third phase? Rapid filling phase. Now, just compare with the systole. We have rapid ejection phase. In ventricular systole, we have rapid ejection phase. In ventricular diastole, we have rapid filling phase. We have what, ma? Rapid filling phase. So what is happening with the name itself? We can see when the atrioventricular valves are open, there is sudden rush of blood from atria into the ventricles. Suddenly the valves are open. So at the first, At first, how, do you know this thing? Tap water is coming slow. If tap water is coming slow, what we will do? We will try to hold the water for 5 to 10 seconds. We'll try to hold the water for 5 to 10 seconds. Yes or no?
Yes, sir.
Yes or no? So immediately when you open, how the water will come? Forcefully it will come. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Why? Because when you hold the blood, when you hold the tap there, when you hold the tap there, what will happen? Slowly the pressure is built inside the pipe. Yes or no? The water content is also there. So when the water pressure is little increased, when you open the tap, forcefully the water will come. Forcefully the water will come. But but after 2 to 3 seconds, will the water forces will remain same? Again, slowly the water will start to come. So what is happening here? Pressure changes. What is happening here?
Pressure changes.
So what is this rapid filling phase means? Now the pressure in the atrium is increased or decreased? Increased, because in atrium what is happening? Atrial systole. What is happening?
Atrial systole.
Now both the atriums are receiving. Right atrium is receiving from superior vena cava, inferior vena cava, the great veins, and the left atrium is receiving from the four pulmonary veins. Left atrium is receiving from
Four pulmonary veins.
So what is happening here? The atrium are filled with blood. That means the pressure in the atrium is
Increases.
now when the atriums are starting to emptied, when the atriums are starting to release the blood, the pressure will remain constant or the pressure will decrease.
Decrease.
So when the pressure is high, the blood filling is high. When the pressure is low, the blood filling is little.
Slow.
So that's what here we have: rapid filling phase and slow filling phase. Rapid filling phase and
Slow filling phase.
Similarly, when we are discussing about ventricular systole, there is rapid ejection phase, there is slow ejection.
phase.
Yes or no?
Yes, sir.
Yes or no? So now we know what are the stages. Now we know what are the stages. Now, here. Why you are roaming outside? అమ్మా క్లోజ్ చేయకు దగ్గరికి వేసుకోవచ్చు క్లోజ్ చేయకు దగ్గరికి వేసుకోవచ్చు Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Listen to me. Now we have rapid filling phase and there is one more phase which is called as slow filling phase. One more phase which is called as slow filling phase. It is called as slow filling phase. Now what is the slow filling phase? As the pressure in the atrium is decreased, as the pressure in the atrium is decreased, now after this sudden rush of blood, the ventricular filling becomes slow. Now this is called as slow filling. It is also called as diastasis. It is also called as diastasis. Now the filling time lasts for 0.19 seconds. This phase will last for 0.19 seconds. This phase will last for 0.19 seconds. Now last one. We have last rapid filling phase. We have what, ma? Last rapid filling phase. Now, this last rapid filling phase occurs of atrial systole because of atrial systole. Now, after the slow filling period, the atria contract and push the small amount of blood into ventricles. The flow of additional amount of blood into ventricles due to atrial systole, and it is also called as atrial kick. It lasts for 0.11 seconds. It lasts for 0.11 seconds. Now listen to me. When atrial systole is beginning, when the atrial systole is beginning. Now, before Amma, just ఒక్కసారి Listen. So when the atrial systole actually begins, whether the impulse is passed to the entire atrium or the impulse is pertaining to the right atrium. SA node. Wait, look at this picture. You get my point? So when initiation of the SA node, here who is excited means SA node is excited. Now from SA node it has to pass to the entire atrium. Yes or no? So how it is passing? It is passing through the Amma? Intama? What it is using? It is using the internodal pathway. So how many types of internodal pathway are there? Yes or no? Back and back is there, anterior, posterior is there, and middle is there. Posterior, what we are calling? Amma? Thoral. Yes or no? Yes or no? So through the internodal pathway, it reaches the entire atrium and it reaches the AV node. It is taking little time or not? Now, what happens here? So, due to the pressure build up in the both atria, and there is loss of pressure, low pressure in the ventricles. It will stimulate the both tricuspid valve and bicuspid valve to open. So here the pressure is high, here the pressure is low. So we have rapid filling phase. So by the time the impulse is reaching the entire atrium, there is one more phase which is called as a slow filling phase. It lasts for about 0.19 seconds. It is also completed. Now, by the time the entire impulse reaches the atria will give one type of kick. Contraction kick. It will give one type of contraction kick. So, because of that kick, there is late rapid filling phase. Now, first two phases occur because of low pressure differences. Whatever the rapid filling phase is there, whatever the slow filling phase is there, it occurred due to the low pressure. It occurred because of the protodiastolic phase. These two phases, what rapid filling as well as slow filling phase has occurred. Now, by the time the actual atrial systole occurs, little amount of blood is remaining in the both atriums. So, when the impulse is coming, when it is contracted completely, last rapid filling phase will occur. So by the time here the ventricular pressure is increased, so this atrioventricular valves will close and semilunar valves open. When the semilunar valves begins to open, ventricular systole starts. If ventricular systole is starting, the ventricles here from AV node, it is reached to the bundle of his. From bundle of his, within milliseconds, it is reached to the apex of the heart. From apex of the heart, ventricles will contract. Yes or no? It is reached to the apex of the heart from bundle of branches, right and left respectively. From here, with the help of Purkinje fibers or Purkinje fibers, this is reached to the entire heart. Am I clear? Yes or no? This is your cardiac cycle. So it includes atrial events and ventricular events. So atrium is contracting and relaxing. So contracting of atrium is called as systole. Relaxation of atrium is called as contraction of ventricle is called as ventricular. Contraction of relaxation of ventricles is called as ventricular. Last three, all three Bengali girls come and sit in front. You three only. Not you. Those three ladies. Hello, you sit down, ma'am. She. Three, last three. Please come. Next time, I don't want you to see there in the corner. You have to sit front, here or there. If they are not allowing, sit in these places. No daydreaming. What, ma'am? No daydreaming. Okay? Listen. Now, we have discussed regarding the cardiac cycle. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yeah, please. Now, what is remaining? What is the remaining? Amma? Amma? Blood? Blood vessels is remaining. Blood vessels is? Okay. If you turn to page number 4.13, if you turn to page number 4.13, there is an image which is showing you clearly regarding the atrial systole. What are the events that will occur in the cardiac cycle? We have atrial systole, isometric contraction and ejection period. We have protodiastolic period. We have isometric relaxation, and also we have rapid and slow feeling. So that was the cycle. If you want a clear picture, you can look in your textbook and you can understand. Whatever we have discussed. So during the atriolar events, during the ventricular events, whatever the events we have discussed, everything is there in that cycle. Okay, in a shortcut form. If you learn that cycle, automatically you can write what is a cardiac cycle. What is a cardiac cycle? You have to always remember that when atriums are in diastolic period, ventricles are in systolic period. When ventricles are in systolic period, atrium is in diastolic. Atrium also has to get filled. Atrium also has to send the blood to ventricle. Yes or no? Yes or no? So there is contraction phase, there is relaxation phase, respectively. So you need to think that, and you need to. So when the atrium is depolarizing, when the atrium is depolarizing, P wave will show us. What will show us? P wave will show us. And what does the QRS complex is showing means? It is showing us the ventricular systole. It is showing us the ventricular systole. And what is this T wave is showing us means? Ventricular diastole. Ventricular diastole. Now, if there is any problem, while ventricles are relaxing, if there is any problem in the ventricular diastolic phase, T wave is getting absent, or T wave is deformed. T wave is deformed. If there is any problem in the ventricular systolic events, how many events are there in ventricular systole? A rapid ejection period is there. Isometric contraction. Yes or no? Yes or no? So, what is this rapid ejection? What is this slow ejection? What is this isometric contraction? Now, isometric contraction occurs first. Yes or no? Yes or no? Isometric contraction occurs in ventricular systolic phase. What happens during the ventricular systolic phase? The tension in the muscle fibers increasing without the change in the length. Without change in the length. So, followed by ventricular ejection period. So, there is rapid ejection, there is slow ejection. Do you get my point? So, this is how you need to understand. This is how you need to write the cardiac cycle. This is how you need to write the cardiac cycle. So, just you remember those pictures. I'll send these slides to you. You can take out and you can write the diagrams and all which were included. Okay. Now we'll discuss what is the structure and position of blood vessels? What is the structure and position of blood vessels? ఇక్కడ ఇంకా కొంచెం ఇంకా కొంచెం ఇంకా రా ఇదిరా listen to me carefully. So this is the atriolar system, arteries, how the arteries are distributed in your body. Inko picture kelam, pie picture kelam. This is showing you how the veins are distributed in your body. This picture shows you how the veins are distributed in the body. So we have the picture how the veins are distributed. We have the picture how the arteries are distributed. Arteries are distributed. Now we'll see what is the position, how the blood vessels are called, how the blood vessels are distributed. Now you know exactly last 2 to 3 classes we have discussed about the difference between artery and a vein. We have discussed the difference between artery and a vein. Am I clear?
Yes, sir.
Yes or no?
Yes,
so
sir.
while we are discussing, I discuss you the structure of blood vessels. Yes or no?
Yes, sir.
The structure of blood vessels. So when you turn your pages, any blood vessel, whether it is an artery or a vein, it has lumen. It has what, ma?
Lumen.
Lumen. Now it has like tunica media, tunica intima, tunica adventitia. Yes or no?
Yes, sir.
Yes or no? Now what is this tunica interna? What is this tunica media? What is this tunica externa? We'll see clearly one by one. Okay? We'll see one by one clearly. Listen carefully. So, we are talking about the blood vessels in the body. We are talking about the blood vessels in the body. Now, what happens here? Now, the heart pumps blood into arteries. The heart pumps blood into arteries, and arteries divide and subdivide, and finally end in capillaries. The arteries divide, subdivide, and they end in capillaries. Yes or no? Yes or no? And the capillaries later unite to form as vein. The capillaries later unite to form as vein. Now, exactly what are these arteries? What are these veins? What are these arteries and what are these veins? Now listen to me carefully. Now there is a different types of blood vessels which are there in the body. We are going to see the relationship of different types of blood vessels. We are going to see the relationship of different types of blood vessels. Now the heart will pump the blood into arteries. Yes or no? Yes or no? So from arteries, the blood is entering into arterioles. The arteries, the blood is entering into arterioles. From arterioles, the blood is entering into capillaries. The blood is entering into capillaries. From capillaries, the blood will enter into venules. You get my point? It is a cycle actually. It is a cycle. It will enter into the venules. From venules, it will enter into veins. From venules, it will enter into veins. From veins, it will again enter into heart. From veins, it will again enter into heart. From heart, the blood will reach pulmonary artery. The blood will reach what, ma? Pulmonary artery. That is again we call it as cardiac circulation. Respiration. What is happening there? The blood is carried to lung. From lung, it is purified and it is brought back to heart again. Again, these arteries, the blood, oxygenated blood is entering arteries. Yes or no? Yes. From arteries, arteries are subdivided into arterioles. Arteries are subdivided into arterioles. From arterioles, the blood is entering into capillaries. At the cell level, at the organ level, they are there as arteries as well as arterioles. Organ level, they are there as arteries and arterioles. But when it comes to the cell level, they are becoming as capillaries. Arterioles and capillaries. From capillaries, venules will arise. From capillaries, venules. So when this oxygenated blood is entering into the capillaries, it is utilized by the cells. It is utilized by the cells. Now, when cell is utilizing, oxygenated blood is becoming deoxygenated blood. Oxygenated blood is becoming deoxygenated blood. Now, this deoxygenated blood is entering into the venules. Is entering into the venules. From venules, it enters into the veins. From venules, it enters into the veins. And from veins, it enters into the heart. Do you get my point? This is always a cycle. This is always a cycle. This is always a cycle. So now we'll see what is the difference between an artery, what is different between arterioles, what is the difference between capillaries, what is the difference between venules, what is the difference between veins. Now, do you think all the blood vessels are same? When we have to call it as an artery, when we have to call it as a vein. Yes or no? So first of all, we'll see what is the structure of a blood vessel. What is the structure of a blood vessel? So when you take the artery, so here both the artery and veins are having tunica externa. Both of them are having tunica externa. So we call it as tunica adventitia. Other name is tunica adventitia. Yes or no? Yes or no? So both of them are having tunica externa. Otherwise tunica adventitia. Tunica adventitia. Next, we have the inner muscle layer which is called as tunica media. We call it as tunica media. Then we have a connective tissue. Followed by we have internal muscle which is called as epithelium of tunica intima. Epithelium of tunica intima. Otherwise we call it as internal. So later we have lumen. So if the valves are present, if these type of valves are present, you call it as a vein. If valves are absent, you call it as an artery. Now, smooth muscle is thick when compared to smooth muscle in the
Vein. Veins.
Am I clear? Yes or no? So this is the basic structure. So if we want to go further in detail, అంత క్లియర్ గా లేదు పిక్చర్ అమ్మా క్లియర్ గా లేదు పిక్చర్ లాస్ట్ టైం మనం తీసిన పిక్చర్ చాలా ఈజీగా ఉంది So listen. So this is the tunica intima, this is the tunica media, and this is the tunica externa. Now externa, tunica externa. This is the outer covering layer of a blood vessel. Now, what does this tunica externa contain means? It contains collagen fibers and vasa vasorum. So this is the tunica externa. So the external layer of a blood vessel. The external layer of a blood. Now we have to talk about the media. Tunica media. What this tunica media means? It is the middle layer. It is the middle layer. Now what it contains means it contains smooth muscle and elastic fibers. It contains what ma? Smooth muscle and elastic fiber. And it also contains external elastic lamina. It also contains external elastic lamina. Now you have to listen, spot one difference here. You have to spot one difference here. So if it is an artery, in tunica media, it is consisting of smooth muscle and elastic fibers. It consists of smooth muscle and elastic fiber, and it is also having a special structure which is called as external elastic lamina. And this particular external elastic lamina is absent in a vein. Now, when we are talking about the intima, the inner layer, inner layer, now endothelium is present both in vein and artery. Subendothelial layer is present both in vein and artery. Subendothelial layer is present between vein and artery, and there is one more additional layer to an artery which is called as internal elastic lamina. Now when we are talking about the lumen, artery lumen is little narrowed when compared to the lumen of the vein. Artery lumen is little narrowed when compared to the lumen of the vein. Am I clear? And what are the special structures that are present in the vein means they contain valves. Now, arteries are having two special structures when compared with the vein. What are those two special structures means? In tunica media, we have external elastic lamina. In tunica intima, we have internal elastic lamina. And this external elastic lamina and internal elastic lamina both are absent in the vein. And when you talk about the pressure is always higher in artery when compared to vein. The pressure is always higher in artery when compared to vein. Am I clear? Now, what is the special structures that are present in artery means it has internal elastic lamina, it has external elastic lamina. What are the special structures that are present in vein means they contain valves. They contain what, ma? Valves. They contain valves. Now, arteries carries the oxygenated blood. Deoxygenated blood is carried out by the veins. Deoxygenated blood is carried out by the veins. Except pulmonary vein. Except pulmonary artery. Pulmonary arteries carries deoxygenated bloods, and pulmonary veins carries oxygenated blood. And there is one rule, because it is carrying away from the heart, it is called as an artery, and this particular blood vessel does not contain any kind of valves. Even though it is carrying deoxygenated blood, it does not contain any kind of valve. So that's what it is coined to be. It was termed to be as an artery. Whereas the veins, when they are bringing blood from lungs to heart, even though they carry oxygenated blood, because they contain the valves, even though they are carrying deoxygenated blood, they are bringing blood towards the heart. That's why we call it as a vein. So we know what is the exact difference between artery and a vein. No. Yes or no? So previously we have learned clearly that the arteries, blood vessels which are carrying blood away from the heart are arteries, towards the heart are veins. That was clear. But when you go for the structure, the arteries have other two additional features. That is, they have internal elastic lamina, external elastic lamina, and they lack one of the main parts which the veins have. Veins have valves, whereas arteries doesn't have any kind of valves. and the lumen of the artery is small when compared to the lumen of the vein. When compared to the lumen of the vein. So without wasting time, let's go to your textbook. Let's go to your textbook. Now, types of blood vessels. Arteries. What are these arteries? The wall of an artery has 3 layers. The wall of an artery has 3 layers, but has a thick muscular to elastic tunia media. So here, when we are discussing, so tunica externa is same for both of them. Tunica externa is same in both the vein and artery. Tunica externa is same in both vein and artery. But when we are talking about tunica media, I said smooth muscle is thicker when compared to the smooth muscle of the vein. Yes or no? So arteries have thicker smooth muscle, veins have thin smooth, and arteries have special type of layer which is called as external elastic lamina, and the veins, this external elastic lamina is absent. In the veins, this external elastic lamina is absent. Yes or no? Yes or no? Now, due to their plentiful elastic fibers, arteries have normally high compliance. Though they can handle much pressure, which means their walls stretch easily or expand without tearing in response to small increase in pressure. Now, because of the presence of elastic fibers, what is elastic? What is elastic? So, when the pressure increases in the blood vessel, अगर इसमें प्रेशर थोड़ी ज्यादा हुआ तो ये टूट जाएगा और थोड़ी लंबा होते। क्यों लंबा हो रहा है? क्योंकि वहां पे इलास्टिक फाइबर से। जब इनका वेन के बारे में बात करते हैं, थोड़ी प्रेशर ज्यादा हुआ तो क्या होते हैं? टूट जाएगा और लंबा होते। टूट जाए। कंपेयर అమ్మా ఇప్పుడు ఆర్టరీని చూసుకుందామమ్మా. ఆర్టరీలో ప్రెషర్ ఎక్కువైపోయింది, సాగుతుందా తెగిపోతుందా? అదే వెయిన్ అంటే తెగిపోయే ఛాన్సెస్ ఎక్కువ. ఎందుకంటే ఇందులో ఎలాస్టిక్ ఫైబర్స్ లేవు, స్మూత్ మజిల్ తిన్గా ఉంది, దీంట్లో స్మూత్ మజిల్ పెద్దగా ఉంది. यहाँ पे स्मूथ मसल बहुत थिन है और यहाँ पे थोड़ी ज्यादा है. तो ज्यादा है तो ज्यादा प्रेशर ले सकते, कम है तो कम प्रेशर लेते. इसलिए इसमें प्रेशर थोड़ी इधर उधर हुआ तो भी कुछ फर्क नहीं पड़ता. थोड़ी इलास्टिसिटी के बारे में वो लंबा होते हैं और कम होते, लंबा होता है और कम होते. लेकिन वैसे यहाँ पे हुआ तो ये टूट जाने की बहुत ज्यादा चांसेस. దీంట్లో మనకి ఫైబర్స్ ఉన్నాయి కాబట్టి, ఎలాస్టిక్ నేచర్ ఉంది కాబట్టి ప్రెషర్ ఎక్కువైనా తక్కువైనా ఇది అడ్జస్ట్ అవుతుంది. కానీ వెయిన్ లో అలా అడ్జస్ట్ అవడానికి ఛాన్స్ లేదు. ఒకవేళ అడ్జస్ట్ అయినా ఎంతో ఎక్కువ ప్రెషర్ మాత్రం హ్యాండిల్ చేయలేదు, తక్కువ ప్రెషర్ మాత్రమే హ్యాండిల్ చేయగలుగుతుంది. ఎంత ప్రెషర్? తక్కువ ప్రెషర్ మాత్రమే హ్యాండిల్ చేయగలదు. నౌ లిసన్, what are arterioles? What are arterioles? देखो, so when we are discussing about blood vessels, అమ్మ ఒక్కసారి అక్కడికి వెళ్ళు, కిందకి స్క్రోల్ చేయి. సరే కూర్చో, అక్కడ కూర్చో. So here when you are discussing about the కొంచెం కిందకి రాని, కొంచెం కింద అంటే ఇలా కాదు, అంత అట్లా ఉంచు. So when we are discussing now entire body, can the artery go to the entire body? They can go, but they have to subdivide. Yes or no? No, subdivision. Now artery is further divided into arterioles. Arterioles. Now arterioles are abundant microscopic vessels. What are they? They are abundant microscopic vessels that regulate the flow of blood into capillary networks of body tissue. They regulate the flow of blood into capillary network of body tissue. Now these arteries are always at the organ level. These are at the organ level. Now we don't need that much of blood into the cells. పెద్ద పైప్ తో కావాలా, చిన్న పైప్ తో కావాలా? అర్థమవుతుందా మీకు? అర్థమవుతుందా? వినండి. సో మనకి హౌస్ హోల్డ్ కి వాటర్ పైప్ లైన్ వస్తుందా? ఇంటికి వాటర్ పైప్ లైన్ వస్తుందమ్మా. వాటర్ పైప్ లైన్ వచ్చి మన ఇంటి దగ్గరికి వచ్చేసరికి వాడు ట్యాప్ కి పెద్ద పెద్ద ట్యాప్ వేస్తాడా చిన్న ట్యాప్ వేస్తాడా? పెద్ద ట్యాప్ అవసరమా మనకి? ఒకవేళ వాటర్ ట్యాంక్ నుంచి వచ్చి ఆ పెద్ద పైప్ లైన్ పెద్దగా వేసాడు అనుకోండి మన ఇంట్లోకి, వాటర్ ఏమైంది? మొత్తం మునిగిపోతాం మనం, అవునా కదా? మనకి ఎంత అవసరమో. సో మన ఇంటి దగ్గర ఇప్పుడు అక్కడ 35 mm 40 mm 50 mm పైప్ వేసాడు అనుకోండి, మన పరిస్థితి ఏంటి? అర్థమవుతుందా? ½ మీటర్ పైప్ వేసాడు లేకపోతే 10 ఇంచ్ పైప్ వేసాడు అనుకోండి, మనకి 10 ఇంచ్ అంటే ఎంత ఉంటుంది అనుకోండి, 15 ఇంచ్ అనుకోండి మీ స్కేల్, మీ రూలర్ స్కేల్. అంత లావు పైపు వాటర్ ఇంట్లో పెట్టుకుంటామా? పెట్టుకో. తప్పు, చిన్న పైప్ పెట్టుకుంటాం. కానీ పెద్ద పైప్ అక్కడి నుంచి వస్తుంది, మెయిన్ పైప్ లైన్ నుంచి వస్తుంది. సో ఇక్కడ పెద్ద పైప్ ఏంటంటే ఆర్టరీ, చిన్న పైప్ ఏంటంటే ఆర్టీరియోల్స్. చిన్న పైప్ ఏంటమ్మా? సో ఇప్పుడు పెద్ద పైప్ నుంచి చిన్న పైప్ సైడ్ కి తీసుకున్నాడు. ఇప్పుడు చిన్న పైప్ డైరెక్ట్ ఇంట్లోకి తీసుకొచ్చి పెడతాడా? 5 ఇంచ్ పైప్ అలాగా పెట్టాడు కదా. ½ ఇంచో 2 లేకపోతే 1 ఇంచ్ పైప్ తీసుకొని ఇంట్లోకి తీసుకుంటాం, అవునా కదా? సో అవే క్యాపిలరీస్. ఇప్పుడు సెల్ వచ్చేసి మన ఇల్లు అనుకోండి, ఆర్గాన్ లెవెల్ వచ్చేసి వాటర్ ట్యాంక్. ఆర్గాన్ వచ్చేసి ఏంటమ్మా? సో వాటర్ ట్యాంక్ నుంచి ప్రతి ఇంటికి సప్లై చేయాలంటే మనకి పెద్ద పైప్ కావాలి. సో ఆ పెద్ద పైపే మనకి ఆర్టరీ. సో ఈ పెద్ద పైప్ నుంచి ఒక స్ట్రీట్ కి ఒక్కొక్క పైప్ లైన్ వేస్తాడు. అది దాని పెద్ద పైప్ తో పోల్చుకుంటే ఎలా ఉంటుంది? చిన్నగా ఉంటుంది. ఆ చిన్న పైపే ఆర్టీరియోల్స్. సో ఇప్పుడు మన ఇంటికి వచ్చే పైప్ అన్న చూసారా, అది క్యాపిలరీస్. అదేంటమ్మా? అర్థమవుతుందా మీకు? అర్థమైతే అర్థం కాలేదా? సో ఆర్టరీస్ ఏంటి, క్యాపిలరీస్ ఏంటి, ఆర్టీరియోల్స్ ఏంటి? ఇప్పుడు ఆర్టరీస్ ఫర్దర్ గా ఎలా డివైడ్ అయినాయంటే ఆర్టీరియోల్స్ గా, ఆర్టీరియోల్స్ ఫర్దర్ గా ఎలా డివైడ్ అంటే कैपिलरीज। अब सुन क्या हो रहा है यहाँ पे, जब हमारा घर का पाइपलाइन रहता है ना, बड़ा पाइपलाइन, बड़ा बड़ा पाइप्स रहते हैं ना, वो पूरा सॉइल मिट्टी में मिलके आते हैं, इतना बड़ा पाइपलाइन, वो सीधा वो बड़ा पाइपलाइन तुम्हारा घर में लाके आ सकते हैं। जब लंबा पाइपलाइन ऐसा जा रहा है, बड़ा लंबा पाइप जो जा रहा है, इससे हम और एक छोटा पाइप लाके हमारा घर की तरफ से लेके आते, और ये छोटा पाइप से हमारा घर वाले को और थोड़ा छोटा पाइप लाके हमारा घर में मिलाते। समझ में आ रहा है? अब देखो ये जो बड़ा पाइप है, इसको हम आर्टरी कह सकते हैं, और तुम्हारा गांव की तरफ जो छोटा पाइप से लेके आ रहे हैं ना, 3-4 घर गांव रहते हैं एक स्ट्रीट पे, एक छोटा पाइप से एक लेके, इसको हम आर्टीरियोल्स कहते हैं। इसको क्या कहते हैं? आर्टीरियोल्स। अभी तुम्हारा घर के लिए और छोटा पाइप से तुम्हारा घर के लिए किचन तक लेके आते हैं, इसको कैपिलरीज कहते हैं। इसको क्या कहते हैं? वो बड़ा पाइप जो है वो ऑर्गन लेवल में रहते हैं, और टिश्यू के लिए हमको क्या चाहिए? आर्टीरियोल्स चाहिए, और सेल्स में जाने के लिए कौन चाहिए? कैपिलरीज। समझ में आया ना? दिस इज व्हाट द ब्लड नेटवर्क इज ऑल अबाउट। ओके, आर्टरीज, आर्टीरियोल्स, कैपिलरीज। नाउ कैपिलरीज, वेन्यूल्स, वेन्स। घर में साफ होने के बाद, पानी यूज करने के बाद सीधा तुम लोग बड़ा रिवर में बेचते? नहीं बेचते। छोटा पाइप लेते कि नहीं? छोटा पाइप लेते कि नहीं? छोटा ड्रेनेज रहते ना घर में, छोटा पाइपलाइन रहते, वो छोटा पाइप से बड़ा ड्रेन में जाएगा पानी, बड़ा ड्रेन से। यस और नो? यस और नो? सो वेन्यूल्स। सो खून कैसे आ रहा है? बड़ा पाइपलाइन से छोटा पाइपलाइन में आ रहा है, छोटा पाइपलाइन से और छोटा पाइपलाइन में, और ये छोटा पाइपलाइन थोड़ी मिलके एक छोटा, इससे थोड़ी बड़ा पाइप में जाएगा, और ये थोड़ी पाइप मिलके एक लंबा पाइप में जाते हैं, इसको हम वेन कहते हैं। यहाँ से खून हमेशा निकलाते, यहाँ से खून हमेशा जाते, ऊपर जाते, हार्ट की तरफ से नीचे आ रहे हैं, ये ऊपर जा रहा है, हार्ट की तरफ जा रहा है, हार्ट की तरफ से नीचे आ रहा है, हार्ट की तरफ ऊपर जा रहा है। You get my point? Now, ఇప్పుడు ఆర్టరీస్ ఏం చేస్తున్నాయమ్మా? గుండె నుంచి రక్తాన్ని తీసుకొస్తున్నాయి. వెన్యూల్స్ ఏం చేస్తున్నాయి? గుండెకి రక్తాన్ని చేరవేస్తున్నాయి. अर्थात सो कैपिलरीज एंड सर, सो जब हम कैपिलरी के बारे में बात करेगा तो ये कैपिलरीज जो है वो टिश्यूज का पास है, सेल्स का पास है। अब खून सेल्स में जाना है ना, जाना है कि नहीं? वो किधर जाएगा बोलेगा तो कैपिलरीज में जाएगा। देखो वैसा these venules are further divided into capillaries. These capillaries are further divided into venules. These capillaries are further divided into
venules.
relationship समझ में आया ना तुम लोगों को? Arteries और venules का relationship समझ में आया ना? तुम नहीं सुन रहे? नहीं सुन रहे? नहीं सुन रहे? बोलो क्या बोला अब तक? वो पाइपलाइन का नाम क्या है? क्या? आर्टी आर्टिकल आर्टीरियोल्स क्या है? आर्टीरियोल्स मैं क्यों वहां से यहां तक तुम लोग लेके आया मालूम? क्यों लेके आया मालूम? आपको समझ में आया क्या बोला? हाँ यस और नो? ध्यान यहाँ पर रहना है. Arteries are bringing blood from heart, then they are sending into arterioles. Arterioles are regulating the blood flow to the tissues. Yes or no? Yes or no?
Yes,
in
sir.
tissues they are turning into capillaries and it is blood is supplied to every cell, and from tissue level these capillaries are becoming as venules. From venules the blood into the veins. From veins the blood is entering into the heart. Is entering into the heart. Yes or no? Yes or no? Sit down. Now we have to take about the arterioles. Arterioles are abundant. Now approximately 40 million arterioles have diameters that range in. What is the diameter of an arteriole? Means 15 mm to 300 mm. 15 mm to 300 mm. Approximately how many arterioles are there now? 400 million arterioles. How many arterioles? 400 million arterioles. Now these arteries are subdivided into 400 million arterioles. Now imagine about the capillaries. Hello. Adi cheppandi. You get my point? Yes or no?
Yes.
Now we have to talk about the capillaries. Now what is the size of an arteriole? Means the arteriole will approximately range from 15 mm to 300 mm. 15 mm to 300 mm. Now when you call it as a capillary, we have to call it as a capillary when the size is below 15 mm. Yes or no? If the size is 15 mm to 300 mm, you can call it as a arteriole. If the size is below 15 mm, you call it as a capillary. You call it as what? What is the size of capillary here? Listen. Capillaries are the smallest blood vessels. Capillaries are the smallest. समझ में आ रहा है? जब देखो यहाँ पे आर्टेरियोल का साइज जो है 15 mm से 300 mm तक रहते हैं. अगर 15 mm से कम है तो वो ब्लड वेसल वो लूमेन जो है वो 15 mm से कम है तो इसको हम क्या कहते हैं? कैपिलरीज कहते हैं. क्या कहते हैं? कैपिलरीज. अप्रोक्सीमेटली कितना आर्टेरियोल्स बोलेगा तो 400 पूरा 400 मिलियन 400 मिलियन आर्टेरियोल्स. अब जब हम कैपिलरी का बारे में बात कर रहा हूं, इसका साइज जो है वो 5 to 10 mm रहते हैं. साइज कितना रहता है? 5 to 10 mm. मकसद देखो कैपिलरीज देखो यहाँ इससे इसको कंपेयर करेगा तो तुमको समझ में आता. समझ में आ रहा है ना आपको? यस और नो? यस और नो? ये देखो ये लूमेन जो है तो ये लंबा है. ये बहुत बड़ा लूमेन है. इसका लूमेन देखो थोड़ी छोटा है. 15 mm to 300 mm. 15 mm to 300 mm. और इसका देखो 5 to 10 mm. 5 to 10 mm. समझ में आया ना? Approximately 20 billion are there. How many? 20 billion capillaries are there. How many capillaries? 20 billion capillaries. How many capillaries ma? 20 billion capillaries. Do you get my point?
Yes, sir.
Yes or no?
Yes, sir.
Now what are the venules? What are the
Venules.
Now we know what is an artery. We know what are arterioles. We know what are capillaries. From arteries, blood is entering into arterioles. From arterioles, blood is entering into capillaries. From capillaries, blood has to enter into venules. What are these venules? Venules are veins that have what kind of wall? Thin wall or thick wall? They have thin wall and do not readily maintain their shape. They cannot readily maintain their shape. Venules drain capillary blood and begin the return flow of blood back to heart. Yes or no? Now they are collecting blood from the capillaries and they are starting the blood to send towards the heart. They are starting to send the blood towards the heart. Yes or no? Yes or no? Now listen to me carefully. Now, venules that initially receive blood from capillaries are called as post-capillary venules. So, initially, when they are taking blood from capillaries, they are called as post-capillary venules. They are called as post-capillary venules. Now, they are the smallest venules, measuring about 10 mm to 50 mm. What is the size of a with arteriole? 15 mm to 300 mm. 15 mm to 300 mm. What is the size of a venule? 10 to 15 mm. 10 to 15 mm. Do you get my point? What is the size of a capillary? 5 to 10 mm. Now, what are venules? Venules carry only deoxygenated blood. What are arterioles? Arterioles carry only oxygenated blood. Arterioles only carry
Oxygenated blood.
venules only carry
Deoxygenated blood.
Do you get my point? Now, venules are extensions of veins, whereas arterioles are extensions of. Do you get my point? Do you get my point? Yes or no?
Yes, sir.
Yes or no?
Yes,
Now,
sir.
what are the structure we have discussed here? It is there even in the arteriole. What are the structure we have discussed here? It is there even in the venule. It is there even in the. But the capillary structure will differ. The capillary structure will. Yes or no?
Yes, sir.
Listen carefully. Now, they are the smallest vessel. Diameter is about 10 to 15 mm in diameter and have loosely organized intercellular junctions. What they have? Loosely organized intercellular junctions. Loosely organized intercellular junctions. आप क्या हुआ? समझ में नहीं आ रहा है ना? The weakest endothelial contacts encountered along with the entire vascular tree. These are very porous. These are very porous. Now listen. What are venules means? Venules are the extensions of veins. Their diameter is about 10 to 15 mm. Now they initiate the backflow of blood towards the heart. They initiate the backflow of blood towards the heart. Since they are present immediately after the capillaries, these are called as post-capillary venules. These are called as post-capillary venules. And they collect the blood. They collect the blood from capillaries. Whereas arterioles, they distribute the blood. Arterioles will distribute the blood. Venules will collect the blood. Venules will collect the blood. Am I clear? Yes or no? Now listen to me. What are veins? What are
Veins.
Now you have to say me. What are veins? What is the structure of a vein? What is the structure of a vein? Veins are larger in lumen. Veins are larger in lumen, and the wall of the vein is thin or thick? Thin. The wall of the vein is thin when compared to the wall of the artery. When compared to the wall of the artery. And the layers of vein will contain tunica externa, tunica media, tunica intima. But what are the structures that are absent means? Internal elastic lamina, external elastic lamina. These are the two structures which are absent in a vein. And veins have specialized parts which are called as valves. They prevent the blood to again backflow. They prevent the blood backflow because veins are taking blood against the gravity. Against the
Gravity.
Am I clear? Yes or no? Yes or no? They are taking blood towards the heart. They are taking the blood towards the
Heart.
okay? Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Now, veins are composed of essentially the same layers as artery. The relative thickness of the layers are different. Tunica interna of veins thinner than the arteries. Tunica media of the vein is thinner than arteries and relatively smooth muscle and elastic fibers. Smooth muscle and
Elastic fibers.
Now, tunica externa of vein is the thickest layer and it consists of collagen fibers. It consists of what, ma?
Collagen fibers.
Next one. The lumen of the vein is larger than the lumen of artery. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Now, arteries and veins often collapse, flatten when sectioned. The walls of vein are not as strong as arteries. The walls of the vein are not as strong as.
Arteries.
Now, artery wall is stronger or vein wall is stronger?
Arteries.
Now, artery wall is thicker or vein wall is thicker?
Arteries.
Artery walls. What are the layers of blood vessel? Tunica, intima, tunica media, tunica.
Externa.
Now, tunica media consists of smooth muscle and elastic fibers. Now, tunica media is thicker in artery when compared to the vein. Tunica intima is thicker in artery when compared to the vein. Now, tunica externa is almost the same. And when compared to artery, externa is little thicker in vein. Externa is little thicker in vein. Am I clear? Am I clear? So the walls of the arteries are stronger when compared to the walls of the vein. When compared to the walls of the vein. Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
So we have seen. Now we have to see the circulation of blood. We have to see the circulation of blood. Chukuma. Go. Always come. Go, you can go. You want to go? Go. No problem. Leave. I know you are not interested in class. You can leave. Huh? You can leave. If you want to leave, you can leave. No issue. You want to go, you go. Why you are disturbing her? Huh? You want to go means you can go. You want to stay means you can stay. Okay. Now, this is the picture which show you how the actual arteries is divided. Okay, how the arteries are actually divided. Now, if you see particular picture, amma slideshow ikkada idi nokku cheptanu. Slideshow. No, current slide idi press. Right. Listen. Now, if you look at this picture, you can see the structure. This is what you call it as arch of aorta. This is what you call it as arch of aorta. So, this is whatever the starting structure that is there. Starting structure that is called as ascending aorta. That is called as
Ascending aorta.
Now, whatever the conical structure, whatever the part that is bending, So that is, this is not there in your book. Just for understanding purpose, I am saying. If you want to write down, you can write down how the arteries are dividing into arterioles. How the arteries are dividing into arterioles. Now, from the left ventricle, what is happening? The artery system is arising. The artery system is arising. Initially, this part, whatever this part is, the initial part, immediately after the immediate superior to the heart. Superior to the heart, we have ascending aorta. We have what, ma? Ascending aorta. We have arch of aorta. We have
Arch of aorta.
and from arch of aorta, we got basophilic trunk and we got subclavian artery. We got basophilic trunk and we have subclavian artery. Now, one part is going as common carotid arteries. One part is going as common carotid artery, and another part is going as vertebral artery. Another part is going as vertebral artery. Now, followed by there is external carotid artery. There is internal carotid artery. External carotid artery and internal carotid artery. Now, we have to talk about the subclavian. How the blood vessel is artery is passing to your hand. How the blood is passing to your hand. Now, how it is passing? Because it is in the subclavian region. This is called as subclavian region. So you call it as subclavian artery. You call it as subclavian artery. So followed by, so when it is in the brachial region, you call it as brachial artery. You call it as brachial artery. Now, this brachial artery is further divided into, if it is towards the thumb side, it is called radial artery. If it is towards the little finger side, you call it as ulnar artery. So, subclavian artery, brachial artery, subclavian artery, brachial artery, followed by radial artery and ulnar artery. Radial artery and ulnar artery. Now, this radial artery and ulnar artery will fuse together and form superficial palmar arch. They fuse together and form
Superficial palmar arch.
So this is how the blood is supplied to your hand. This is how the blood is supplied to your hand. You can say, sir, from heart, subclavian artery is coming. That is fine. From subclavian artery, you said there is a brachial artery. There is a brachial artery. Now, when the blood vessel is passing through axilla, so from ascending aorta, arch of aorta came. From arch of aorta, we got a subclavian artery because it is passing through the subclavian region. This is the clavicle bone. So sub means in between the clavicle bone, it started to come here. So from here, it is going to. This part is called as axilla. This part is called as axilla. So I can call it as axillary artery. I can call it as axillary artery. From axillary artery, it is going to the brachial region. It is going to the. So I can call it as brachial artery. Can I call it as brachial artery? Yes or no?
Yes, sir.
Now this from brachial side, the bone is being divided into radial bone and ulnar bone. Radial bone and ulnar bone. So radial side, if it is going, two types it is divided. So radial side, one part, one artery is going. So radial artery and ulnar artery. Radial artery and ulnar artery. Till now, artery is not divided into arteriole. If you can observe, yes or no? Yes or no? Now here, what is happening? This radial artery, ulnar artery, both they fuse together and they form deep palmar arch. They form
Deep palmar arch.
Now, after deep palmar arch, how many fingers we have?
5.
So each finger has to be supplied or not?
Yes, sir.
Each finger has to be supplied or not? So you call that finger as digital arteries. You call that finger as
Digital arteries.
You call that finger as.
Digital arteries.
Am I clear?
Yes, sir.
Am I clear? So how is the blood supply to the hand? Listen to me. From arch of aorta, subclavian artery is coming. What is coming? Subclavian artery is coming. What is coming, ma?
Subclavian artery is coming.
So what is happening here? This subclavian artery is sending. What is this sending? It is divided into axillary artery. It is divided into axillary artery. This axillary artery, whatever the axillary artery is there, this axillary artery is divided into brachial artery. It is divided into brachial artery. This brachial artery is divided into two types: radial artery and ulnar artery. Radial artery and ulnar artery. Now, this radial artery and this ulnar artery will fuse together and form deep palmar arch and superficial palmar arch. Deep palmar arch and superficial palmar arch. Now, this deep palmar arch and superficial palmar arch will further divide into digital arteries. Will further divide into digital arteries. And these digital arteries will supply blood to your fingers. Will supply your blood to. So you can see both the hands. You can see. So if it is left side, you can see left brachial artery. If it is right side, you can say right brachial artery. Yes or no? Yes or no? Yes. Now I told you subclavian vein. How, from where this subclavian vein is coming means this subclavian vein is arising from basophilic trunk. It is arising from basophilic trunk. So if you want to make it very simple, from ascending aorta it is divided, or from arch of aorta it is divided into so subclavian vein, from subclavian artery, from subclavian artery axillary artery, from axillary artery to brachial artery to radial artery, ulnar artery. Radial artery, ulnar artery will fuse into deep palmar arch and superficial palmar arch. From there we got digital arteries. From there we are getting digital arteries. So what is the site for checking the pulse here? Radial. Yes or no? You can feel. If you want to check, you can check. Am I clear? Yes or no? So this is the structure of blood supply to the hand. This is the structure of blood supply to the hand. What? This is the structure of blood supply to the hand. Now, similarly, what ma? Similarly, your legs also has to be supposed. Your legs also has to get blood. Yes or no? Yes or no? Now, how it is getting means this arch of aorta, whatever it is there, the arch of aorta, whatever is there, is further extended to thoracic aorta. Arch of aorta is further extending to thoracic aorta. What ma? Thoracic aorta. Now, this thoracic aorta is divided into abdominal aorta. Is divided into abdominal aorta. Is divided into what part? Abdominal aorta. Then from this abdominal aorta, we have branches that form celiac trunk. So we have left gastric artery. Abdominal organs are there, no? Abdominal organs unnaya leva? Unnaya leva? So we have left gastric artery. We have left gastric artery. We have splenic artery. Liver common hepatic artery. What you call common hepatic artery. ఇప్పుడు మనకి mesenteric సప్లై చేస్తాం కదా. mesenteric artery ఉందా లేదా? స్టమక్ పైన కవర్ చేసుకుంటూ లేయర్స్. సో దాన్ని mesenteric artery అంటాం. ఏమంటామా? mesenteric artery అంటాం. ఇప్పుడు renal సప్లై చేస్తే renal artery. రీనల్ సప్లై చేస్తే ఏంటమ్మా? రీనల్ ఆర్టరీ. సో ఇప్పుడు రీనల్ ఆర్టరీ అలాగే కింద మీసెంట్రిక్ లేయర్ సప్లై చేస్తుంది కాబట్టి పైన చేస్తుంది కాబట్టి సుపీరియర్ అని, కింద చేస్తుంది కాబట్టి ఇన్ఫీరియర్. పైన చేస్తుంది కాబట్టి సుపీరియర్ మీసెంట్రిక్ ఆర్టరీ, కింద చేస్తుంది కాబట్టి ఇన్ఫీరియర్. समझ में आ रहा है आप लोग को? हाँ, समझ में आ रहा है? Now whatever the mesenteric artery is there is further divided into common iliac arteries. It's further divided into common iliac arteries. What is happening? A common iliac artery. Now common iliac artery is further divided into external iliac artery, internal iliac artery. External iliac artery and internal iliac artery. Now these external iliac arteries and internal iliac arteries, whatever it is, they are again fused in backside. Collateral circulation will be present. So these arteries are further divided into femoral artery. These are further divided into femoral artery. Why femoral artery means here because the femoral bone is present. You call it as femoral. This is the femoral region. This is the femoral region. Now from this femoral artery, because it is passing the popliteal region, you call it as popliteal artery. You call it as popliteal artery. From popliteal artery, we have anterior tibial artery, posterior tibial. Now, if the blood vessel is passing on the anterior side of the tibial bone, you call it as anterior artery. If the blood vessel is passing posterior side of the tibular bone, you call it as posterior tibular. Now again, how they formed? Okay, how they formed arch there? Deep palmar arch and superficial palmar arch. Here also we have arcuate artery. Here also we have arcuate artery. Now to the feet. To the feet, who is supplying blood supply means arcuate artery. To the leg, what is the blood artery supply means tibial artery and posterior tibial artery. To the knee, what is supplying popliteal artery. To the femoral portion, what is supplying femoral. So this is the blood supply to the hands and feet. Hands and upper limbs and lower upper limbs and lower limbs. So this is the just outline. This is just outline. If you want to discuss deep, we can go and further discuss deep. This is the blood vessel structure. Veins, next slide. This is the veins. This is the veins. You get my point? Yes or no? So we have distal arteries. That means we have digital veins. We have radial artery. We have radial vein. We have ulnar artery. We have ulnar. We have brachial artery. Yes or no? So we have brachial vein. Vein is there or not? Yes or no? Now from here we have axillary vein. We have axillary vein, and this axillary vein it will go and attach to the superior vena cava. So axillary vein when passing to the subclavian region, we call it as subclavian vein. We call it as subclavian vein. So this is how the blood is utilized. Blood is written from hand to the heart. This is how the blood is coming from. See here, feet to the heart. So same, how it passed, it will come back in the same way. So how we call means it depends upon the type of region the veins are being supplied. From backside, if you take the leg, you call it as great saphenous vein. You call it as great saphenous vein. So if you want to really know what is great saphenous vein, when you are sitting, when you are alone, or else when you are taking bath, you just try to palpate. You can find a vein here. Just try to palpate. That is nothing but the great saphenous vein. That is nothing but the great saphenous vein. Now, whatever the veins that you are seeing, popliteal vein or posterior tibial vein or fibular vein, these veins are great saphenous vein. These veins, they are used in cardiac bypass surgeries. They are used in cardiac bypass surgeries. So when we are discussing about heart pathologies, I told you there is a condition which is called as atherosclerosis. There is a condition which is called as atherosclerosis. Actually, what they do, for suppose, come on, back up. Escape button, okay, ESC button. Fire and the chimpara. Each. ESC. Kimna? Pipe will. Listen carefully. As you can see this picture, here the blood vessel is narrowed or the blood vessel is fine? Blood vessel is narrowed. So here, if the blood vessel is narrowed, can the blood pass from this part to this part? No. So there is a process which is called as PTCA. Next slide, next slide just. So what they are doing, they are inserting a catheter in the narrowed space. They are inserting in a catheter in the narrowed space, and they are trying to open the closed artery. They are trying to open the closed artery. So when they open the closed artery, what is happening? There is re-establishment of blood circulation. There is re-establishment of blood circulation. But if this is not working, if this is not working, if we are unable to perform this perfectly, the blood flow, if the blood, even after performing this, if even the blood flow is not established, then we go for a process which is called as CABG. Then you go for a process which is called as CABG, coronary artery bypass grafting. Coronary artery bypass grafting. Coronary artery bypass. Now, everybody know what is bypass? Yes or no? Yes or no? What is a bypass? bypass मतलब क्या है? एक बड़ा रास्ता रहते, एक रास्ता रहते, लेकिन वो रास्ता में जाने के लिए हमको बहुत टाइम लगेगा. जब अंदर ये सिटी से जाने की तो हमको जरूरत नहीं, हम तब क्या लेते हैं? बाईपास लेते. बाईपास ले लिया तो हमारा जगह किधर पहुंचना है वहां पे हम पहुंचते, लेकिन ये पूरा जगह कवर करने की हमको जरूरत नहीं पड़ता. वो दूसरे रास्ते से हम जा सकते. ఎస్ ఆర్ నో? అమ్మ ఇప్పుడు బైపాస్ అంటే ఏంటి? ఒక ఇప్పుడు కాకినాడ ఉందనుకోండి, కాకినాడ నుంచి యానం వెళ్ళాలనుకోండి, కాకినాడ నుంచి వెళ్ళాలని రూల్ ఏమైనా ఉందా? లేదు. మనకి ఎక్కడ కడుతున్నా? అచ్చంపేట జంక్షన్ దగ్గర బైపాస్ ఉందా? లేదా పిఠాపురం జంక్షన్ దగ్గర ఒక బైపాస్ ఉంటది. ఇలా అలా దూరం నుంచి అలా లోపల నుంచి తీసుకుని వెళ్తాడు, అవునా కదా? అది రీసెంట్ గా ఫ్లైఓవర్ అయి కన్స్ట్రక్ట్, దాని బైపాస్. ఇప్పుడు ఏంటి, మనం కాకినాడ సిటీలోకి రావాల్సిన అవసరం ఉందా? కానీ మనం యానం వెళ్ళొచ్చా లేదా? ఎస్ ఆర్ నో? సో ఇక్కడ కూడా ఏంటంటే ఈ ఉంది కదా బైపాస్ గ్రాఫ్టింగ్ అంటే, ఈ ట్యూబ్ నుంచి ఇలా ఇంకో ట్యూబ్ తీసుకొచ్చి ఇక్కడ కనెక్ట్ చేస్తాడు. क्या कर रहा है? यहाँ पे इसको काट के यहाँ से यहाँ तक एक कनेक्शन देते, फिर खून ऐसा जाने के लिए जरूरत नहीं, बाईपास ले सकते. यस और नो? यस और नो? समझ में आ रहा है? सीएबीजी मतलब क्या है? यहाँ खून जो यहाँ तक आया, लेकिन यहाँ पे बंद है, रास्ता बंद है, तो यहाँ से यहाँ तक नहीं आ रहा है. हम क्या करते हैं? एक नया रास्ता बना के रखते हैं वहां पे. नया रास्ता क्या है? ग्राफ्टिंग. हमारा जो वेन से ग्रेट सेफालस वेन और पॉप्लिटियल वेन वो जो है वो हम वहां से निकाल सकते, वो यहाँ पे लाके यहाँ पे एक नया रास्ता बना के रखते. फिर क्या होते है? हार्ट का सर्कुलेशन शुरू होते है. यहाँ पे जो ब्लैक हो गया वो हील होते धीरे धीरे. इसको हम कहते हैं सीएबीजी. दाने माना सीएबीजी, कोरोनरी आर्टरी बाईपास ग्राफ्टिंग. समझ में आ रहा है? अब जब हम कोरोनरी सर्कुलेशन का पढ़ाई कर रहा हूं, क्या पढ़ाई किया? एक राइट साइड आ रहा है, एक लेफ्ट साइड आ रहा है. इसको हम क्या कहते हैं? सर्कमफ्लेक्स आर्टरी, लेफ्ट सर्कमफ्लेक्स आर्टरी, है कि नहीं? Yes or no? Yes or no? Now this is called as arterioventricular groove. Yes or no? Yes or no? This left circumflex artery is further divided. This artery is called as anterior interventricular artery. Anterior interventricular. अगर यहाँ पे ब्लॉक हुआ तो इसको हम बाईपास करते, यहाँ पे ब्लॉक हुआ तो इधर हम बाईपास करते, इधर ब्लॉक हुआ तो मार्जिनल आर्टरी ब्लॉक हुआ तो मार्जिनल आर्टरी को हम बाईपास. समझ में आ रहा है आपको? This is how you call it as CFA. This is how the pathology in the heart is resolved. This is how the pathology in the heart is resolved. Did you understood what are veins, what are arteries? Yes or no? Yes, sir. Yes or no? Yes, sir. Any doubt? Any doubts? Yes or no? Yes or no?
No, sir.
No. Okay. In next class we'll discuss about the circulatory system. Particularly, I have given you the outline. Whatever we have discussed here in pictures. What is the blood supply to the hand? What is the blood supply to the vein? What is the blood supply to the thoracic organs? What is the blood supply to the abdominal organs? What is the blood supply to the pelvic organs? We are going to discuss one by one in the next class. Go have a break and come back. Thank you.